Welcome, everyone, and thank you for joining us for our first webinar for Home Parenteral Nutrition Awareness Week, presented by Nutrishare, titled Navigating the HPN Roadmap from First Infusion to Long-Term Management. And today is also our first ever webinar contest. For all of you joining live, please stay on until the end when we will announce our winner. Sharing a couple of quick housekeeping items before we get started. This is a webinar format, which means attendee cameras and microphones will be off. We will only be able to see the presenters. And while we will not be utilizing the chat or raise hand feature, you can use the Q&A function in the toolbar at the bottom of your screen if you have questions during the presentation, and our presenters will answer them at the end. This webinar will be recorded and made available on our website at oli.org/HPN. The information provided during this and all of OLI's presentations is for educational purposes only and is not intended as medical advice. Although clinical information is peer-reviewed, you are advised to consult with your healthcare team before making any changes to your care plan. Before we get started, we would love to learn a bit more about you. So for everyone joining, are you a patient, caregiver, healthcare provider, or industry partner? So I'll leave this up for a little bit. So for those of you joining us live, are you a consumer of nutrition support, a patient? Are you a caregiver for someone on nutrition support, a healthcare provider, or an industry partner? So far, it's pretty divided amongst industry partners and patients, and then healthcare providers at about 55%. We'll give it another minute to see who's with us live. All right, so we have about 15% of our audience as patients or consumers themselves, about 3% caregivers, 61% healthcare providers, and about 20% industry partners. So now, to get us started, please allow me to introduce your 4 speakers today. Elena Stoyanova is the Director of Nursing Services and Clinical Education at Nutrishare with over 13 years of experience in critical care, education, leadership, and home infusion. Her work focuses on empowering consumers and strengthening interdisciplinary collaboration to ensure safe, high-quality care at home. Kelsey Griffin is a registered dietitian and director of patient onboarding and nutrition with Nutrishare. She has 11 years of experience specializing in nutrition support for various patient populations. And for the past 9 years, she's been a certified nutrition support clinician focusing on acute and long-term infusion therapy for adults and pediatrics. We're also joined by Larissa Grigorich, the clinical nutrition outcomes and research manager at Nutrishare. She's a certified nutrition support dietitian with over 10 years of experience. Larissa has been published and presented on topics such as malnutrition, body composition, indirect calorimetry, and patient-centered models of care. And then Crystal Wilkinson is a clinical pharmacist with Nutrishare with over 16 years of experience in diverse pharmacy settings. Her primary focus has been in home infusion, where she's developed a passion for the collaborative nature of care. Without further ado, I'm honored to turn it over to you to kick it off, Elena Stoyanovich.
Welcome, everyone.
My apologies, Elena Stoyanova.
It is quite all right. You got it pretty close there. Welcome, everyone, consumers, caregivers, clinicians alike. Today, we'll focus on 3 key areas that make the transition from hospital to home on parenteral nutrition successful. We'll cover initial steps. This is what needs to happen during discharge and early planning to set a strong foundation. We'll also highlight interprofessional collaboration, showing how different team members work together to individualize care. And finally, we'll discuss sustainability strategies, preventing infections, managing complications, and supporting quality of life for the long term.
Before we get into the details of the roadmap, it can help think of the journey home on parenteral nutrition in terms of 3 milestones: transition, monitor, and thrive. Transition is about laying the groundwork, ensuring safe movement from hospital to home with the right preparation and support. Monitor focuses on the ongoing assessments and adjustments that keep therapy on track. And thrive reflects the long-term goal. The PowerPoint went away. There we go. And thrive reflects the long-term goal, optimizing quality of life through prevention and proactive management. These 3 milestones mirror our objectives and provide a clear structure for understanding what it takes to succeed in the home. Next slide.
Well, before we dive in, I really want to give you a big picture view of what the journey with home parenteral nutrition, or HPN, sometimes TPN, PN, many names for the same thing, typically looks like. Everyone's path is unique, but the process usually follows a set of key phases. Understanding these phases helps you know what to expect, where you are in your journey, and how each step builds towards the next. It really all begins in the hospital, right? This is where our medical need for HPN will be determined, insurance coverage will be verified, and your central line will be placed. Therapy is started and stabilized while your team identifies your support system and gets connected with a home infusion pharmacy as well as a nursing agency. You're going to hear us talk about education a lot, so education will start here too, and it's really the foundation for everything that will follow. Next comes transition. This is really the bridge between hospital and home. Here, your HPN regimen is finalized, your plan of treatment is defined, and education continues. You'll get your home logistics in place, like deliveries and that initial nursing visit, to make sure that you're well supported when you go home. Once you're home, the focus will shift to routine and safety. Supplies will be delivered, that nursing team will follow up with visits and ongoing education, and you'll stay in close communication with your pharmacy and care team. This is where confidence will grow as you settle into your new rhythm. We'll be walking through each of these phases in more detail today, looking at what matters most from different perspectives each step along the way. Next slide, please.
Here you can see the key members of the team involved in your home parenteral nutrition care, with you, the consumer, at the center. Nursing focuses on patient and caregiver education, implementation of infection prevention protocols, and assessment of home environment to ensure safety and suitability for therapy. Nutrition monitors nutrient adequacy and tolerance, and integrates oral or tube feeding when appropriate. Pharmacy ensures PN stability, compatibilities, and reviews drug interactions. The medical provider is responsible for comprehensive care coordination, the management of comorbid conditions, and clinical decision-making regarding therapy adjustments. Their role will not be the focus of the subsequent slides. We will examine the key areas of focus of the dietitian, pharmacist, nurse, and you, the consumer, at each stage of the HPN journey. Although care is delivered through a collaborative team approach, each discipline has a distinct roles and responsibility that we will explore in this presentation. Now, Larissa will start us off with the HPN journey.
So let's talk about what happens in the hospital when someone is identified as needing parenteral nutrition, and how the registered dietitian, your RD, supports both the healthcare team and you to ensure a safe transition home. When you are first admitted or identified as needing nutrition support, the inpatient RD will begin with what's known as a full nutrition assessment. This will involve evaluating your current nutritional status. We're going to look at your weight and lab trends and clinical notes from other members on the healthcare team. And we're going to also obtain some important background information from you, or if you're not feeling up to an interview, maybe your family, about your nutrition history and your recent intake. Using both this subjective information and objective data from the chart, the dietitian will then determine the best method of nutrition support. So that could be parenteral nutrition, right, through a vein, enteral nutrition through a feeding tube, or a combination depending on your condition and gut function. Once the assessment is complete, the RD collaborates with the interdisciplinary team to design an individualized PN formula. The information from this nutrition assessment will guide the composition of the formula: how much energy, calories, protein, fluid, electrolyte, vitamins, and minerals that you will receive. A key part of this process is recognizing and addressing potential risks when starting parenteral nutrition. The RD works closely with the team to watch for and prevent problems that can happen when your body starts getting nutrition again after being sick or maybe undernourished. One of these potential complications is called refeeding syndrome, which can occur when nutrition is introduced too quickly, causing dangerous electrolyte shifts. To give you a little bit of background, electrolytes like sodium, potassium, and phosphorus help your heart, muscle, and nerves function properly. By monitoring and adjusting the nutrition plan based on risk, the RD can help prevent or catch and treat issues early, keeping you safe as your body adjusts. When you're in hospital, the focus will be on short-term goals to support recovery. So this may include meeting that daily calorie goal, just to give your body enough energy, or preventing further weight loss while you heal. If it's been determined that you will require long-term PN, the RD will help initiate the transition process early. With assistance from case management or maybe social work, a referral will be sent to a home infusion team to review your case. This will allow for coordination between the hospital and the home infusion provider, as well as to give ample time to train you and any caregivers to ensure that the PN regimen is safe and sustainable outside the hospital. Once your condition stabilizes and you're ready to go home, that's when we could look at some longer-term nutrition goals to help you to continue to improve on your journey. Throughout the process, the RD's role is both clinical and supportive, ensuring that the formula meets your clinical needs while also preparing you and your caregivers with education, confidence, and resources needed to manage the PN safely at home. Next slide, please. As discharge approaches, the inpatient and home infusion RD will really look at your referral together. This double check will help prevent confusion once you're home. Some consumers will be fortunate enough to have both a clinic RD and a home infusion RD managing their care, but some will transition fully to the home RD. However, for the purposes of this presentation, I'm just going to focus on the dietitian's role in general terms. Your PN is a formula that's been tailored specifically to you, and it's going to be tweaked throughout the hospitalization. During those assessments, your dietitian will check in to see how you're feeling. They may ask you things like, are you feeling like you have more energy? Are you experiencing less nausea or maybe fewer GI issues that you were experiencing prior? They'll also talk a lot about your hydration. For example, if your nurse is not measuring your urine output, they may ask you how often you're urinating. Does your urine look dark? Because these can be signs of dehydration. And on the flip side, to make sure that you're not getting too much fluid, they're going to do a quick physical assessment to check for any swelling. If your PN formula has been staying relatively the same, meaning that your labs have been within normal limits and fewer changes have been needed day to day, that's another good sign that you're tolerating your formula. Once you're steady on your regimen, your care team can then reduce lab monitoring from daily to weekly. You'll also start learning the hands-on part of your care. The dietitian is going to work closely with other members of the team, like the pharmacist and the nurse, to teach you and your caregivers how to safely handle your PN. As my colleagues will be going a little bit more in depth on those topics, I'm not going to get into too much detail about it, but I do want to talk a little bit about enteral. So if you're going to go home with a feeding tube in addition to your home parenteral nutrition, the RD will educate you on your enteral regimen, including what formula, what method of administration, is it a bolus, on a pump? If it's on a pump, what's the rate? And any related care guidelines that you need to know. If you're able to eat, your dietitian will review any therapeutic diet guidelines that you should be following. They're going to talk a little bit about food safety at home, how to safely handle food, what things to avoid, and how to best support your gut health while on PN. Together, you'll talk about your home setup, where to store your PN, and how to create a clean and comfortable space to infuse, and how can it fit smoothly within your routine. Behind the scenes, your RD is coordinating with many members of the healthcare team. Pharmacy, nursing, social work, case management, and that home infusion company. We're working to make sure that supplies, delivery schedules, and that coverages are all in place. Before discharge, your RD will ensure that safe handoff, that every order is clearly communicated to that home infusion team so that what is started in the hospital continues seamlessly at home. And we're going to kick it over to Crystal to look at the pharmacy program view.
As Larissa mentioned, many interdisciplinary teams are involved in the transition to home parenteral nutrition. Just like your dietitian focuses on nutrients your body needs, your pharmacist focuses on those nutrients, how it's prepared, delivered, and monitored safely. When you're in the hospital, the inpatient pharmacist closely works with the interdisciplinary team to make sure that the PN is started safely. They double check every component of your PN prescription to ensure that it is compatible and stable. The pharmacist will also monitor for potential medication interactions and review any IV medications that you may be receiving to ensure nothing negatively interacts or forms a precipitant when infusing together. The pharmacy team follows a strict USP 797 sterile compounding standards, meaning that your PN is prepared under the safest and cleanest conditions possible. As you get ready to leave the hospital, the referral is sent to the home infusion pharmacy. The pharmacist there will carefully review your chart, including notes from the care team. While reviewing your case and determining if you meet criteria for home PN, the pharmacist will also review your allergies to medications, food, or supplies. And some of the PN components or packing materials may need to be adjusted to prevent a reaction. Reviewing your medication list also helps to prevent duplication errors, dosing errors, or potential interactions. The pharmacist will also verify your central line, where it is placed, and what type of catheter you may have. If you have a lock solution ordered inpatient, the pharmacy team will determine if your catheter is compatible with it. The home pharmacist will assess if a lock is ordered, see if we have stability information and sterility information that can last for approximately 7 days at home. Line information also helps to ensure the correct flushes, tubing, connectors, and supplies are ordered for home infusion. Your pharmacist's next responsibility is to review your PN prescriptions for safety, compatibility, and stability. They will check and review your macros to ensure that it's appropriate dosing, and your electrolytes to ensure that they're in the safe range and that will not cause precipitation. They'll also ensure that all the required vitamins and trace elements are present in your formula. Before your parenteral nutrition is made and sent home, the infusion pharmacist takes several important steps to make sure that it's safe, accurate, and appropriate alongside any of your concurrent therapies. They often check to see if there's other IV medication that has been ordered. They could determine whether or not it can or cannot be co-administered with your PN. The home pharmacy will also ensure that a pump is ready for you upon discharge. Several ambulatory pumps are available in the market. Your input helps to guide the selection. The pharmacist will help choose the best option based on factors such as ease of use, visual or dexterity needs, noise level of the pump, experience with pumps previously, and also battery use as well. Now let's turn it over to Elena, our expert nurse, to talk about the nurse's perspective.
Nursing plays a key role in laying the foundation for safe transition at home. What this looks like can vary depending on the hospital and how transitions of care are coordinated, but the goals are consistent across the border. Identifying learning needs, prepare the home environment, become structured education, and most of all, set you up for success. One of the first steps that nursing and the care team in general takes is assessing barriers to learning, both cognitive and physical. We want to understand how you best take in new information and what may make this learning easier or harder for you. For example, let's say you have limited vision or dexterity. We will involve caregivers more closely right away and adapt how we teach to your needs, but also to your caregiver's needs as well. The goal is to make sure education is accessible and builds your confidence, not overwhelm you. Early conversations focus on home setup. Yes, we're not at your home, but we still need to have those conversations to make sure that basics are in place, that you have running water, refrigeration, electricity, and a clean, organized space for supplies. We also identify caregivers who may be able to support you at home. These details may seem small, but they make a significant difference once you're outside the hospital. Once we understand your needs, we begin education, and we try to do this in small, well-timed increments so we're not overwhelming you and so you're successful after discharge. We start by reviewing your medical condition and why HPN is needed. Then set clear learning goals so everything is broken into manageable steps for you. Understanding the why behind your therapy helps you become the best advocate for your ongoing care. One of the major focuses of early teaching is infection prevention. Hand hygiene is a crucial step to infection prevention. We teach when and how to wash your hands, especially before touching your line, medication, supplies. We also want you to know hand sanitizer is okay to use, especially if your hands are not visibly dirty. Hand washing may seem like a simple concept, but I cannot emphasize enough how important it is. Aseptic technique is another important concept to master before you go home. Now, I know this sounds very technical, but really at its core, it's all about keeping germs away from your body and your line. The central line goes straight into your bloodstream, so even tiny bit of contamination can cause serious infection. So frequently when we talk aseptic technique, there's like a few simple concepts that we can break it down to. Key parts, these are sterile parts of your equipment, like think about your syringe tips or the inside of the injection cap, the end of the tubing. They should not be touching anything that's not sterile. Your hands are not sterile, the outside of the packaging is not sterile. If they touch this, they're contaminated. Think of it as a straw. If you drop the straw on the floor, you hopefully will go get a new one. And it's kind of the same concept here. If a key part is contaminated, stop and replace it. Then we move on to key sites, which are the vulnerable spots where germs can enter. Think about the injection cap, the exit site on your skin, the dressing. Those are areas that you need to keep clean, covered, and protected. And last but not least, the septic fields. They're how we protect everything while we work. The septic field needs to be clean, organized, and free from distraction. So to sum it up, this whole concept is you're going to protect the key parts, again, keep them sterile, guard the sites, keep them clean and covered, and control your aseptic field. Another piece of the infection prevention puzzle that often gets overlooked is how you store your supplies. Proper storage of your PN, medications, and equipment is just as important as how you handle them. Keeping everything in the right place at the right temperature helps prevent contamination and keeps your therapy safe and effective. When you put all these pieces together, good hand hygiene, solid aseptic technique, proper storage, you are creating a safety net for yourself at home. As we move through the preparation for discharge, we continue to focus on building confidence, making sure that you and your caregiver feel supported and ready to manage this at home, because this already has been a lot of information, right? So you're learning a lot, and we have to continue to practice and do hands-on, make sure that we're addressing, if you're a visual hands-on learner or auditory, we got to meet those needs. And this is where this education really continues. Let's talk about central line basics. First, it's very important to understand what kind of central line you have. Different lines like PICCs, tunneled catheters, implanted ports, they can have slightly different care routines, way they're accessed, or even dressing requirements. So knowing exactly what type of line you have helps you follow the right steps every time, but also it makes it easier to communicate clearly with your care team if something comes up. From there, we focus on how you keep this line safe day to day, which is a huge thing. And there are a few key areas that I would like to emphasize. Infection prevention, I already covered the principles, but this is where you start putting the principles into practice, practicing disinfecting the needleless connector appropriately, attaching tubing using aseptic technique, and knowing what early signs of infections look like. Things like fever, chills, drainage at the exit site are red flags that you should never ignore. We also talk about line securement. Keeping your line stable prevents accidental pulling or movement, which can cause damage or even increase infection risk. Depending on your line type, this may mean using a securement device, carefully taping the tubing to avoid snags, or making sure a port needle is anchored properly. Then dressing and needleless connector changes. These are also key routine steps and so important to your safety. At the beginning, in most cases, they are done by home health nurse once you go home. But it's important to understand the why behind it. Both the dressing and the needleless connectors are usually changed every 7 days or sooner. Keeping the dressing clean, dry, and intact between those scheduled changes is very important. And if you notice something doesn't look right or doesn't feel right, make sure you let your medical team or your home health nurse know so that they can address it right away. We also teach you how to flush your line properly. You learn the correct technique, how often to flush, and what to do if something feels, again, unusual. What if you suddenly start meeting more resistance? We don't want you to keep on pushing. We want you to let us know so we can help you troubleshoot. But again, in this stage, you learn what feels right and what's not. Um, Infusion pump. This is the engine that makes your therapy run at home. For many people, this is the part that feels so intimidating at first, but it's also where the hands-on practice really makes things click. We start by walking through pump-specific supplies you use. That may be tubing, batteries, battery chargers, additional accessories. There are several pumps, like Crystal mentioned, on the market, and they all come with their own set of accessories. So we help you like lay hands on this, make sure you understand how to use them, because getting familiar with these items ahead of time helps take away really the mystery out of it. So nothing feels intimidating when it's time to go home and infuse at home. We also go over setting up and programming the pump step by step, loading the tubing, priming the tubing, programming, initiating, stopping it. Watching somebody do it is helpful, but what it really builds confidence is when you do it. So by the time you go home, you have a routine in place. And we also want you to know what the alarms are. They're there to keep you safe. And it's very important for you to understand what they mean ahead of time. So it's way less stressful when you encounter them. Another key piece is infusion safety. Before each infusions, there are a few critical checks we teach every consumer and caregiver to do. Check the label carefully. Make sure that the name and date of birth match yours, and verify the medication, the expiration date, dose, etc. Inspect the HPN bag and any additional medications. Look closely for leaks, discoloration, any particles floating in the solution. The key here is to remember that if something looks off, do not infuse it. Call your home infusion pharmacy or your medical team. Just trust your gut instinct. Once those checks are done, we'll teach you how to prepare and administer the infusion. This is where practicing the steps again and taking notes is crucial, because you're going to have to duplicate this process at home. And you have to be able to understand how each piece goes together. After setting up and starting the infusion safely, we also talk about complications, or even maybe before this, at some point we talk about complications, both metabolic complications and those related to the line. And we don't expect anyone to become an expert overnight, but we want you to understand what's normal versus not what's not, and when to call for help. Some of my colleagues already talked or will talk about some of the metabolic complications, but let's say blood sugar will be monitored. And so you need to know that maybe blood sugar can rise during the infusion because of the dextrose in your PN bag, but you don't have to have diabetes. That may just happen. So that's why you monitor your blood sugar if your medical team advises you to do so. And your team well monitors this, but symptoms like unusual thirst, frequent urination, fatigue may signal a problem. Larissa already touched upon on dehydration, and that can also develop and become a pretty serious complication if not addressed in a timely manner. Central line issues can vary in severity. For example, infections can occur at the exit site, they can occur along the tunnel, or in your bloodstream. You need to be looking out for redness, swelling, drainage, fever, chills. These are all warning signs. And if any of those happen, don't wait. Go to the ER, get evaluated, get timely care. Line damage. It happens because you're living your best life out there, everyday life, but sometimes accidents happen. Maybe the line just broke, and what you need to do is address it right away. Climb the line between the break in your body. Go to the ER. There's just such a huge variety of complications, and you're going to learn over time again what's important and what's not. Again, bleeding from the exit side, you may see some bleeding oozing after your central line is placed, but over time, like let's say a month down the road, seeing unusual bleeding from the exit side, that's not normal and it needs to be addressed. And when we talk about all these complications, because again, a long list of things that can happen, the goal isn't to scare you, it's to prepare you. By knowing what to look for and acting early, you can prevent small issues from turning into bigger problems. And remember, you're never on your own. Your care team is just a phone call away, ready to help whenever things don't seem right. But your awareness and quick actions are powerful parts of keeping you safe at home. And I'm going to turn it over to Kelsey to discuss what we would like you to know as a consumer.
So as a consumer, what do you need to do while you're in the hospital and preparing for discharge? When you're first introduced to home PN in the hospital, it's completely normal to have a lot of questions. Even if you are a seniored TPN patient, you may still have a lot of questions if they're changing your routine. There's a lot of new information coming at you quickly when you're inpatient. What I really want to encourage you to do in the early stages is make sure you understand the basics. Ask about the PN. What is it? What's in the bag? Why do you need TPN? How long will you need TPN? Don't be shy about asking people to put things in plain language. This is your care and you deserve to fully understand it. Next, try to imagine what the HPN routine in your home will look like. What will your routine be? How will that change your daily life? How will you work that into your life? I also encourage you to focus on ways to prevent complications early. This means learning infection prevention basics, how to handle your supplies safely, and what warning signs should prompt a call to your team. So watch the nurses, ask questions as you're getting the cath care, as they're flushing, touching your line. Ask them how you should be doing this at home. If you're going to be on other medications or treatments alongside PN, make sure you understand what they are and how they fit into your schedule. Can you safely flush those meds while doing PN, or do you need to stop PN? Look how that will affect your daily routine and ask your care team. And finally, ask about the teaching process itself. Who will be teaching you? What skills will you be practicing? How is the education broken up? Knowing this ahead of time can make learning process feel much more manageable. And don't forget to take notes and write down any questions you have so you do not forget when your care team is available. This is really important to have because a lot of times when the doctors, nurses, dietitians come in the room and ask if we have any questions, typically that's when we get a complete blank stare and we don't remember any of our questions. So as you're sitting there, write down the questions as they come up, put them in your phone so they're readily available when they come around. The biggest thing is getting involved. I encourage all of you to be your own advocate. Ask questions. Speak up if something doesn't make sense. Let your care team know if there's something you want to explain differently. Get to know your care team and how to reach out to us. Each of us, nursing, pharmacy, doctors, nutrition, plays a different role, and understanding who to call for what will make it easier when you're having a complication or an issue. If you have a caregiver, now is the time to involve them. Make sure they're part of the teaching process and they feel comfortable with the plan too. Even encourage them to have notes and write down questions prior so they don't forget them themselves. Even while you're still in the hospital, it's helpful to start thinking ahead about home. Think about your space. Where will you store all your supplies? Do you have a place to keep them all organized? Do you have a place for the infusion area, something safe away from pets that can be cleaned and sanitized? Identify any of these areas so when you're home, it will make that transition easier and you already know where everything will go. Consider any challenges you might face. Is your space tight, or is your schedule extremely complex? And share those concerns with your team so we can all problem solve together. Before going home, start thinking about your daily routine at home with PN tasks. Take step-by-step notes on your setup so you have something to refer to later. Think about the timing. When will you take the PN bag out of the fridge? How long will your infusion run? When will you disconnect? How does this fit into your day? And then finally, keep a clear contact list handy. Your home infusion pharmacy, including their after-hours numbers, your home health agency and or your nurse, and your treating provider and or clinic. Also notate any follow-up appointments you have coming up. Having this ready will reduce the stress when you're home if something comes up. Now I will pass it to Larissa, and she will discuss nutrition and transition and home management.
Thanks, Kelsey. When you think about your care team during your journey on parenteral nutrition, the dietitian's kind of like the quarterback. They're coordinating plays, making sure everyone's connecting, and helping you move safely from hospital to home, right, over the goal line. Maybe they're a little bit like a coach too. Do you like my analogies? They're going to make sure that there's a game plan or a clear monitoring plan in place. For example, when you go home, do you need to still monitor your intake and output? You're going to need to weigh yourself. Is it daily, once a week? How often are your labs going to be scheduled? Where do you have to go to get them done, if anywhere? They're going to make sure everyone knows what's going on, so everyone knows exactly what to watch for and when. In your early days at home, your dietitian is often your first call. They'll call to check on you to see how you're feeling, how you're tolerating your PN. They may help you with things like pump alarms, because we all know that's going to happen. They'll talk to you about your fluid changes, or are you experiencing any changes in your blood sugar? If something doesn't feel right, your dietitian's going to work with the rest of the team to fix it quickly and safely. For example, if your blood sugar suddenly rises, and that's never been an issue for you before, that could actually mean a sign of infection. And so your dietitian's going to promptly loop in the right team members to start the next steps quickly to address this potential concern. Your dietitian will look at what your body needs to meet goals, whether that's healing, recovery, rebuilding strength after illness, or supporting healthy growth for children that are on PN. I want you to think about your body like a car, right? You're like a Porsche. It needs fuel to run, but not just any fuel, right? You need the best of the best. Your dietitian's going to make sure you're getting the right blend, the premium fuel your body needs to heal and thrive. Once you're stable, the focus will shift to maintenance and optimization. Your RD is going to continue to work with you to adjust your PN schedule to fit your home life while keeping nutrition balanced. And you've heard it a lot today, education will never really stop, right? Your dietitian and your care team, they're going to keep reinforcing good technique, safety, and symptom awareness. So if things like dehydration, fluid overload, or something a little bit more scary like a line infection happens, you'll understand what your symptom needs and who you need to call. While many people think of PN as just a bag of nutrients, your dietitian and the rest of your team really do see this as a living plan that grows and adapts with you, guided by teamwork, close monitoring, and a focus on your safety and quality of life. And so now we're going to hear from Crystal on the pharmacy perspective.
As you, the consumer, transition from hospital to home, the pharmacist's priority is ensuring safety, accuracy, and continuity of care. This phase involves many interconnected steps, with the pharmacist collaborating closely alongside the dietitian, nurse, healthcare provider, and most importantly, you. I find this phase the most exciting and rewarding aspect of my role as an infusion pharmacist. When the consumer transitions from the hospital to receiving parenteral nutrition at home, it requires careful planning and a strong collaboration to ensure the process is safe and also seamless. The pharmacist acts as a gatekeeper. Before any PN leaves the pharmacy, the pharmacist has to check, verify that the order is accurate, checking for all the calculations, reviewing compatibility and also stability. Beyond preparation, the pharmacist carefully monitors your lab results to identify reasons behind any changes, such as increased output, vomiting, dehydration, or even medications that you may or may not have told the pharmacy changes. Collaborating with your dietitian and your provider, adjustments to your prescriptions are made based on these findings. The pharmacist also ensures that your infusion pump is programmed correctly, coordinate necessary supplies, and work with the nursing staff on proper storage and handling to maintain the safety and effectiveness of your PN at home. Additionally, they manage the logistical aspects, including the delivery of your PN to your home. While the dietitian and pharmacist work together to fine-tune your nutrition formula, the pharmacist's primary focus is on medication safety. They will always ask you if there's any new or changed medications, supplements, vitamins, any changes in anything that you put in your mouth. It's very important to tell the pharmacy team because it can impact your PN stability, compatibility, and also your lab results. Effective communication is critical. It helps to prevent drug interactions and complications with your infusion line. In essence, the pharmacist serves as your safety gatekeeper, ensuring that every PN bag, pump, medication that you use at home is safe, compatible, and tailored to your individual needs. Pharmacists often like to work behind the scenes, but they are fully engaged, ensuring timely preparation, safety, delivery of your PN, and confirming all supplies and medications are on hand, and collaborating with your nurse to support your education and confidence in managing your home therapy. Now, let's hear from our dedicated nurse, Elena, who will share her perspective on this transition.
Thanks, Crystal. Once you transition home, nursing support shifts towards reinforcing skills, providing ongoing education, and building confidence in daily care. We continue hands-on training, which includes HPN setup and infusion, IV medication administration, central line flushing, infection preventions. Hopefully, by this point, you have practiced these skills in the hospital. But in the home phase, we focus in applying what you learned and taking this at home and figuring out how this applies to your everyday routine. Home health nursing plays a key role here in this stage. We make sure you know who your home health agency is and how to reach them. The home health nurses not only provide ongoing education, but they also perform weekly central line dressing changes and needleless connector changes. They draw labs, they monitor for complications. They're critical safety net, helping you identify issues early on and reinforcing best practices over time. Finally, we emphasize emergency preparedness. And here I have an example of what an emergency preparedness checklist may look like. But it is essential for everybody on HPN because power outages, natural disasters, supply delays can happen unexpectedly, and having a plan ensures that the therapy can continue safely. The goal is to reduce stress, avoid preventable complications, and keep therapy uninterrupted during emergencies. Okay. And Kelsey?
So as you move into the transition phase, this is where things start to shift from hospital to home. It's the bridge between learning and living with home parenteral nutrition day to day. There are a few things that should be especially important to you during this time. First, make sure your home PN plan is finalized and you understand it, that it makes sense to you and your lifestyle. This includes your formula, any medications you'll be receiving, making sure all your allergies are documented. Try to understand the PN label. Always double checking for name, date of birth, and looking at that formula, making sure that that is your bag. The pharmacy team will do final checks, but this is your care. So review the details with them and ask questions until you're comfortable. I really emphasize on if you do have questions in regards to your care, go to your care team. Try not to use AI or any of those platforms because you're not always going to get accurate information out of them. So if you do have questions, go to your healthcare professionals. You'll also hear something about your plan of care, or your nurse might say POT. Think of this as your personal roadmap for your therapy at home. Our second step is keep building on what we've already learned. This is a great time to reinforce important skills, things like central line care, recognizing early signs of complications, and knowing what to do if something doesn't seem right. You should also start to feel comfortable with what you'll be expected to monitor routinely at home. For example, your weight, intake. So your intake will be your oral intake, your enteral, PPN, hydration, output, stools, vomiting, G-tube output, blood sugars if that's a part of your plan, and any vital signs. I do recommend keeping a journal for yourself, writing those down so each day you know where your baseline starts to sit at and you see a pattern if there becomes one. Then these numbers will help your team spot changes early and keep your therapy on track. The more you ask questions and practice now, the more confident you'll feel once you're at home. Third, let's start focusing on practical pieces that make life easier at home. Know when and how your medications and supplies will be delivered. Make sure you understand where to store them and how to keep track of what you have. Make a system that works for you. Not all systems work for everybody, so find something that works for you and own that system. This is also when your first nursing visit is usually scheduled, when you come home. That visit isn't a test, it's a safety net. It's your chance to go over everything in your real environment, ask questions, and make sure your setup works for you. No question is too small. Finally, one important thing is to stay in close communication with your home infusion pharmacy. They're your main resource for supply issues, PN concerns, troubleshooting questions. Keep their contact information handy and don't hesitate to reach out. That is what we're here for. And I'll pass it to Larissa.
Thank you so much. Now, as you move into long-term management of parenteral nutrition, the focus will really shift to maintaining health and quality of life. Your dietitian will continue to do ongoing nutrition assessments. They'll adjust your plan as your needs evolve. Your dietitian is going to be diligent about monitoring for any food, nutrient, medication interactions to ensure that your nutrition support remains safe and effective. A key goal during this phase is preventing long-term complications, such as liver disease and metabolic bone disease. The RD may make recommendations to the team to draw specialized labs that are not routinely monitored, like maybe your vitamin D level, parathyroid hormone, direct bilirubin, just to name a few, or they may even recommend imaging studies such as a DEXA scan. Over time, changes may be made to your formula to reduce liver stress and support bone health. Your RD will also monitor for nutrient deficiencies and will make adjustments based on what's needed. For example, if you have increased ileostomy output, your dietitian may add some extra zinc to your PN to replace what's being lost. Over time, you may also need less of certain trace elements. One example I could think of is manganese. This is actually a contaminant in many of the PN products, and it can build up in your body. So in those cases, the trace metal blend may be changed from that standard commercial mix to a more customized formulation for you. As you move out of the acute phase, your calorie and protein needs will shift. To use my favorite analogy of the car, right? You're just not revving your engine nearly as much, meaning that your body's not burning that same amount of energy. Or maybe now you're getting fuel sources from elsewhere, like an oral diet. So you're kind of like a hybrid car now. You're going to need to fine-tune that premium fuel formula again to meet you where you are on your journey. The stage is built around consumer-centered goals, meaning your priorities, comfort, and lifestyle are at the heart of every decision we'll make. Your dietitian will work with you to meet short-term goals like labs within limits, or longer-term goals like returning to usual body weight, or just feeling well enough to attend an event that you've been looking forward to, like maybe a graduation or a wedding for a family member. If we haven't already done it in the hospital, we can cycle your PN at home. This will allow for more flexibility, so you're going to get the same amount of PN in less time. It could free up time during the day if you need to go to work, school, do whatever you need to do. Or if you're having trouble infusing overnight and you decide to infuse during the day, it could potentially help you sleep a little bit more comfortably, right? You're not needing to get up necessarily to use the bathroom at night. If your intestines begin to adapt, your dietitian is going to help guide a weaning strategy, gradually transitioning you towards enteral or oral diet when it's safe. Beyond the numbers, your team will continue to discuss quality of life, your activities, hobbies, energy, and emotional well-being. They'll support you physically and mentally, connecting you with resources if you ever feel stressed, discouraged, or overwhelmed. Ultimately, your care plan should reflect what matters most to you, whether that's having more energy to spend time with family, returning back to work, or just enjoying some of your favorite activities. In this stage, it's really about living well with PN, protecting your long-term health while ensuring your care adapts as life evolves. And now we'll hear Crystal's point of view.
Now let's talk about the long-term, managing long-term in the perspective of pharmacists. Managing PN over time involves more than just, mixing a bag and delivering in the pharmacist's eyes. It requires ongoing monitoring, strong collaboration, and most importantly, a clear, consistent communication between the consumers, caregivers, and the entire care team. Here's a general overview of what's involved in the pharmacist's point of view. First, as Larissa mentioned, regular lab monitoring is key. These labs will help us understand how your body is responding to PN and alert us for any potential complications. Based on the lab results and any health changes, the PN may need to be adjusted. This ensures that your nutritional support keeps up with your evolving needs. When your PN formula changes, the pharmacist will carefully review it for safety, check for stability, compatibility, and make sure everything is safe to infuse. Before each infusion, we always ask our consumers to practice to make sure, as Elena has alluded, as well as everyone else here, to make sure that the PN bags are actually stored in the refrigerator and checking on the temperature in the refrigerator, making sure it's between 36 to 46 degrees Fahrenheit. Confirm the name on the label is yours. Beyond use date of the PN as well. And always visually inspect the bag. Look for leaks, color changes, or anything that's off. For example, if you're getting a 2-in-1 bag or a dual chamber bag, check to see if the clear portion is cloudy, or there are particles, or there's crystallization. Things like anything off that's not clear, you need to call your pharmacy team right away. In a 3-in-1 bag, where the lipids are actually mixed together, you want to make sure that it is uniform. No marbling, separation, or cracking between where the lipids are. Just contact the pharmacy team whenever there's any issues or questions about your PN bag. It is important to let your pharmacy team as well know if there's any changes in your medications, as I alluded several times before, because these medications, certain medications, can affect how your body handles your fluids, sugars, trace, as well as electrolytes. So your PN bags will need to be adjusted accordingly. If you're prescribed any new IV medication, please check with your pharmacist. Some medication may not be compatible to be infused with your PN together, so it may have to be infused separately. Pharmacists play a key role in ensuring reliability and continuous care. We help manage challenges such as drug shortages by proactively looking for alternatives. Something we have all navigated recently and will most likely navigate in the near future as well and currently. We also handle logistics, making sure that your PN supplies are delivered on time, that you have emergency supplies or backups on hand just in case for power outages, natural disasters, or shipments that won't get delivered on time. This may include discussing with your care team whether or not you should have a shelf-stable PN bag on hand as emergency backup. This is not the same as your customized PN bag, but maybe temporary alternatives if it seems safe by your care team. Also having shelf-stable hydration, batteries, extra supplies, and backup pump. It's also important to make sure that you regularly check to make sure that all of these supplies, hydration, or shelf-stable PN are within date. And also check your pumps to make sure they are in working conditions. Whether it's checking it weekly, monthly, just make sure that they are working at all times so when things happen, you have access to it no matter what. Ultimately, our goal is to ensure that you're prepared and supported no matter what comes your way. We will now turn it over to Elena, who will discuss long-term in the nursing perspective.
Yeah, so once you're home and the initial phase is behind you, the focus shifts from learning the basics to ongoing monitoring, support, and growth. This is where nursing continues to play a role in helping you stay healthy, safe, and confident over time. One of the biggest parts of long-term management is monitoring. Your care doesn't stop when you leave the hospital. In many ways, that's when it really begins. Nurses work closely with the rest of your care team to collect regular lab work and do clinical assessment. We also help track how your line is functioning, monitor for any sign of complications, and keep lines of communication open between you, your infusion pharmacy, and your medical team. If something isn't quite right, again, the goal is to catch it early before it becomes a bigger problem. Another key part of nursing's role is supporting your growing independence. Over time, you'll build confidence in managing your daily care, and you may be even able to take on tasks like central line dressing changes. Nursing is there every step of the way, reinforcing skills, troubleshooting challenges, and helping you adapt routines as life changes. Whether it's a new schedule, a travel plan, a change in your health, we help make sure your care plan keeps up with your life. We also focus on quality of life, of course. Living with HPN is usually a long-term journey. And the goal isn't to just keep things clinically stable, it's to help you live well. That may mean working with you to problem solve practical challenges, helping you adjust supplies or routines to fit your lifestyle, or simply being a trusted point of contact when questions come up. Ultimately, the goal in this phase for all of us is to empower you. With ongoing nursing support, regular monitoring, and open communication, you will be able to manage your therapy safely at home, adapt over time, and maintain quality of life. And I will tag Kelsey now.
So, as a consumer in long-term management, as you move along further in your home parental journey, this is where the focus starts to shift from day-to-day learning to setting your own long-term goals. First, let's talk about communication and tracking your health. Over time, one of the most important things you can do is create a routine that works for you. That might mean jotting down things in a notebook, using an app, or a simple calendar, whatever fits your style. You'll want to regularly keep an eye on things like your weight, your intake and output, skin, hair, nails, blood sugar, and vital signs. Anything out of your norm baseline, reach out to your care team. You don't have to interpret everything yourself, but you should know what kinds of changes matter and when to call your team. The earlier you notice the changes, report those to your team, the easier it is to address them before they turn into something a lot bigger. Next, set nutrition and tolerance goals that make sense for you. If you're starting to increase oral or enteral intake, work with your dietitian to set realistic milestones. Not everything has to happen at once, and sometimes we don't hit those milestones, but that's okay. Our journeys are very specific to ourselves. Keep track of how your body is responding to enteral and oral, like nausea, vomiting, bowel habits, or your appetite. This can give your team important clues. And don't underestimate the little wins. Even small steps towards more tolerance or flexibility in your regimen are worth celebrating. Don't get bogged down by the bad, get excited about the little wins. Finally, make it a habit to collaborate on your long-term goals with your team. Regular check-ins help make sure your personal goals and clinical goals stay aligned with your team. And this is the time to speak up about what matters to you most, whether it's your work schedule, family life, travel plans, or anything else. Remember, you're the driver, and your care team is here to support you and your long-term vision. They can help adjust plans to fit your life, but only if they know what's important to you. Make sure you're always communicating. Long-term management is about shaping a life that works for you while staying healthy and supportive. And I'll pass it to Elena to wrap it up.
Oh, Elena, you're on mute.
Thank you. Thriving on HPN is about more than managing your infusions. It's about living fully and feeling supported along the way. This is where your emotional well-being, lifestyle, and sense of control become just as important as the clinical side. First, let's talk about emotional support and connections. Living with HPN can feel isolating at times, and it's completely normal to experience a wide range of emotions. Building a strong support network can really make a huge difference. That might mean joining a support group, staying connected with friends and family, or finding others who truly get it, who understand what you're going through. These connections are often where you get the kind of understanding and encouragement that even the best clinical team can provide. Next is active lifestyle and social engagement. Your activities may look different than before, but that doesn't mean they have to disappear. Adapting your favorite activities or exploring new ones can bring a sense of joy. Whether it's going outside, spending time with others, or participating in hobbies, maintaining movement and connection within your limits can greatly improve your quality of life. And finally, empowered self management. Over time, you become the expert in your body and your routine. Taking an active role in understanding your care plan, communicating openly with your team, and making informed decisions puts you in the driver's seat. Like Kelsey said, you are the driver. The more you feel empowered, the more confident and in control you'll feel in managing your journey, not just day to day, but for the long haul. These three pieces, emotional connection, active living, and self management, are what transforms HPN from something you have to do into something you live confidently with. Thriving isn't about perfection. Nothing is perfect. This is a journey. It's about feeling supported, staying connected, and finding your own rhythm over time. And that concludes our presentation.
Thank you so much, Elena. Thank you, Kelsey, Larissa, and Crystal for sharing your time and expertise with us. And thank you so much to Nutrishare for sponsoring and presenting this webinar. And a big thank you to all of you who attended. If you have any questions, please email info@oli.org, info@oli.org, and we will pass them along to all the speakers. And for attending, thank you, Nutrishare. Thank you to our wonderful speakers. Have an incredible HPN Awareness Week. We have more events. You could find them at oli.org/HPN. I wish you all a terrific Tuesday. Thank you, guys. Bye.